So today I'm going to read the 8 April editorials of the Hindu. So the first one is shaping India's path to inclusive healthcare. Second one is implementing universal health coverage, and then private healthcare needs reform in public interest. These three articles are there in the. It seems to be that whole page of today's this editorial section is dedicated towards it since it's World Health Day. 8th April. 8th April is celebrated as World Health Day. Okay, let's give them a read. Shaping India's path to inclusive healthcare. World Health Day, which is observed every year on 7th April. Okay, 7th April. World Health Day, which is observed every year on 7th April, unites us around health equity, unites us around health equity, an essential topic at the heart of global health and justice. WHO has declared health to be a fundamental human right. The theme this year is My Health, My Right. What is the theme? My Health, My Right. There is an alarming gap in healthcare access, highlighted by the COVID 19 epidemic. Why is writing epidemic? It was a pandemic. Highlighted by the COVID 19 epidemic, environmental crisis, and growing socio-economic gaps. Even though over 140 nations recognize health as a constitutional right, the WHO Council on the Economics of Health for All reports that more than half the world's population needs complete access to essential health services. With the passage of World Health Day 2024, it is clear that promoting health equity is a source of optimism for millions of people, going beyond social justice or legislative change. The meaning of health equity. Health equity ensures that every person has an equal opportunity to achieve their highest health potential, no matter what their circumstances. Recognizing that social, economic, and environmental factors impact health outcomes, this idea goes beyond genetics. This idea goes beyond genetics. WHO's mission is to eliminate unfair and preventable disparities in health among different social and economic categories. True health equity addresses the root causes of health inequities such as poverty, discrimination, limited access to high quality education, a healthy diet, clean water, fresh air, and housing, and merely grants equal access to health care. For example, a child born into poverty in a rural area has no access to clean water, wholesome food, or immunizations, which lays the foundation for chronic health problems. It lays the foundation for the chronic health problems. These differences are made worse by pandemics, climate change, and socio political unrest. India is diverse and has wide socio economic gaps. Thus, this predicament strikes a chord. Access to health care in rural areas is significantly less than in metropolitan areas. Social and economic barriers exacerbate this disparity. The guarantee that everyone may live a healthy life, attaining health equity necessitates a comprehensive strategy. To guarantee that everyone may live a healthy life, attaining health equity necessitates a comprehensive strategy that goes beyond legislative reform to address the socio-economic determinants of health. To address the socio-economic determinants of health, realizing each person's potential for health demands realizing each person's potential for health demands a concerted effort by governments, communities, and individuals to tear down these obstacles. The road to health equity is fraught. The road to health equity is fraught with difficulties ranging from deeply ingrained social injustices to global systematic health concerns, particularly in multicultural countries such as India. Diverse populations need help to get access to high quality healthcare in this place. The global challenges are the fight for health equity confronts global challenges that transcend borders and call for a collective international action. The COVID 19 pandemic has starkly revealed that infectious diseases target marginalized and vulnerable groups that most so infectious diseases it COVID revealed that infectious diseases target marginalized and vulnerable groups the most. thus widening the health equity gap. Climate change poses a serious health risk since it disproportionately impacts low income and vulnerable people. The healthcare provision is severely hampered by the conflicts which destroy infrastructure, uproot communities and shut off access to vital medical services. India's health equity challenge. With a large and diversified population, India faces persistent obstacles to health equity, including notable differences in healthcare outcomes and access. Even though access to healthcare has improved over the past 20 years, there is still much work to be done in rural area. Even though healthcare has improved over the past 20 years, there is much work to be done in rural areas. According to the 2011 census, urban slums make up over 17% of India's metropolitan areas and exhibit serious health disparities. Health risks are increased by overcrowding, poor sanitation, and restricted access to clean water. Infectious disease such as tuberculosis are 1.5 times more common in slums than in non-slum areas, according to Indian Council of Medical Research. Disparities across caste and gender are profound. National Family Health Survey 5 data, NFHS data 5 indicates that scheduled castes and scheduled tribes experience higher child mortality and lower immunization rates. Additionally, 59% of women in the lowest wealth quintile suffer from anemia, almost double the rate in the highest quintile, demonstrating the intersection of caste, gender, and economic status in health outcomes. Non communicable diseases account for more than 60% of all fatalities in India. The Public Health Foundation of India points out that necessity for equitable treatment access and preventive health care, stating that the economic effect of NCDs could surpass $6 trillion by 2030. Economic effects of NCDs, that is non communicable disease, could surpass $6 trillion by 2030. A critical shortage of doctors exacerbates these issues, with WHO data indicating only zero point 0.8 doctors per 1,000 people, which is below the advised ratio. Even though over 70% of healthcare professional works in metropolitan regions, which only account for 27% of the population, the shortage is particularly severe in rural areas. If other medical practitioners are considered, the ratio might be balanced. India's health equity issues require a comprehensive approach beyond improvements in healthcare facilities to address more extensive socio-economic determinants of health. To move India toward universal health coverage and a more equitable future, the government, civil society, healthcare providers, and communities need to work together. Governments and officials may influence the state of health through funding, creative policies, and laws. For instance, India's Ayushman Bharat initiative provides free health coverage to the bottom 40% economically. India's Ayushman Bharat initiatives provide free health coverage to the bottom 40% economically, demonstrating a commitment to reducing health disparities. The National Health Mission (NHM), which includes both the National Rural Health Mission and the National Urban Health Mission, reduces the healthcare gap between rural and urban India by expanding access, strengthening infrastructure, and providing essential services to vulnerable populations. Achieving health equity requires raising health literacy. India should turn health equality into a shared community driven goal by including health education in the NHM, enabling its people to seek equitable care and make educated health decisions. Enabling its people to seek equitable care and make educated health decisions. Together with the government, the public and private healthcare sectors provide services to underprivileged communities, emphasizing preventive education, workforce development, and infrastructure enhancement. Non governmental organizations and civic societies engage in direct community outreach to draw attention and to resolve regional health concerns. Their collaboration with international and governmental organizations allows them to tailor health initiatives that are culturally sensitive to the community's unique needs. International institutions such as WHO, the Global Fund, and Gavi support health initiatives in places with limited resources and promote sharing information and resources to enhance healthcare systems, especially in countries such as India. Through innovation and technical growth, particularly in digital health, the commercial sector and charitable organizations advance accessibility and affordability while extending reach and efficacy. Research institutes and academic institutions offer crucial insights into health inequalities and the efficacy of interventions, assisting in creating evidence based practices and policies supported by scientific studies. Research institutes and academic institutions offer crucial insights into health inequalities and the efficacy of interventions, assisting in creating evidence-based practices and policies supported by scientific studies. Tap these organizations. Organizations with a strong local presence are essential for health equity. They actively participate in every phase from planning to evaluation to guarantee the relevance and effectiveness of health programs. They also have a thorough understanding of their community's requirements. They also have a thorough understanding of their community's requirements. Successful collaborations essential for achieving health equity depend on upon communication, respect for one another, and common goals. They are prepared to adapt to shifting health concerns and community demands because they strongly emphasize empowering communities, sharing knowledge, and building capacity. Effective collaboration among many sectors, ranging from policymakers to grassroots organizations, may significantly enhance health equity and pave the path for a time when access to high quality healthcare would be a shared reality rather than a privilege. The second article talks about private healthcare needs reform in public interest by Abhay Shukla. Dr. Abhay Shukla is a public health specialist and a co-convener of Jan Swasth Abhiyan. All right. Millions of Indians underwent traumatic experience while seeking treatment during the COVID-19 pandemic. This strongly underlined the urgent need for two complementary streams of change in our healthcare system: strengthening public health services and regulating private healthcare providers. In the Indian context, no initiative for reforming the health sector will be complete without touching upon private healthcare, which accounts for around 70% of healthcare utilization in the country. The 2024 Forbes list of billionaires includes 200 Indians. Following manufacturing, the industry that contributes the second largest number of billionaires in India today is healthcare, that is 36, including pharmaceuticals. This number has increased every year, especially during and after COVID-19 pandemic. Private healthcare in India is allowed to make high profits because it is inadequately regulated and often charges patients exorbitant rates. This setting underscores the relevance of policy recommendations contained in the recently published Jan Swasth Abhiyan's 18-point People's Health Manifesto. It contains a wide range of interrelated policy recommendations covering diverse themes including public health services, the private healthcare sector, pharmaceutical policy, and the right to universal health care. Here, I briefly outline some key measures concerning the private healthcare sector in India. Transparency, standardization. Transparency, standardization of rates. Private healthcare providers are perhaps unique among all the commercial services in India, since the rates of their services are generally not transparently available in the public domain. This is linked with the wide spectrum of rates that may be charged for the same procedure or treatment not only by various hospitals in the same area but also from different patients within the same hospital. The Clinical Establishment Rules 2012 specify that all healthcare providers must display their rates and should charge standard rates as determined by the government from time to time. However, 12 years after these legal provisions were enacted, surprisingly they are yet to be implemented. What were those legal provisions? Clinical Establishment Central Government Rules 2012. The Supreme Court has recently intervened in this matter, asking the Union Health Ministry to standardize healthcare rates as per the law. It is high time that transparency of healthcare rates be ensured and standardization of rates be implemented in an appropriate manner. This is technically feasible, keeping in view that thousands of private hospitals routinely accept reimbursement at standard rates for practically all common medical procedures as part of large scale official government programs such as the central government health scheme and Pradhan Mantri Jan Arogya Yojana. These measures can be legally ensured when the clinical establishment rules are implemented or when state governments adopt improved acts of their own, which include similar positive provisions. It is also necessary to implement standard protocols to check irrational healthcare interventions which are currently promoted on a wide scale due to commercial considerations. For example, the proportion of cesarean deliveries in India in private hospitals 80 private hospitals 48% is 3 times higher compared to public hospitals, that is 14%. In private hospitals the share is far in excess of the medically recommended norm for cesarean sections, 10 to 15% of all deliveries. Rationalizing treatment practices and curbing excessive medical procedures will not just bring down excessive bills charged by many private hospitals but also significantly improve healthcare outcomes for patients. Implement implement patients' rights. Given huge asymmetries of knowledge and power between patients and hospitals, certain rights are universally accepted to protect patients. These include the right of every patient to receive basic information about their condition and treatment, and the expected costs of care and itemized bills, the right to second opinion, informed consent, confidentiality and choice of provider for obtaining medicines or tests, and ensuring that no hospital should detain the body of patient on any pretext. In the Indian context, the National Human Rights Commission formulated a set of patients' rights and responsibilities in 2018. Such a charter was circulated by the Union Health Ministry to all state governments in shorter form in 2019 and then in a more comprehensive form including 20 patients' rights in 2021. However, given the lack of official attention given to these rights until now, the Complete Patient Rights Charter, not a diluted version as observed in some hospitals, the Complete Patient Rights Charter must be effectively enforced in all healthcare facilities across the country so that patients and their caregivers can obtain care in conducive environment. Creating such a secure setting would also help to rebuild much needed trust between patients and providers. Further, given the failure of existing mechanisms like medical councils to ensure justice for patients with serious complaints related to private hospitals, it is important that user-friendly grievance redressal system be operationalized from district level upwards with multi-stakeholder oversight. Control commercialization of colleges. Along with these measures on private healthcare, some complementary steps concerning medical education are mentioned in the manifesto. There is an urgent need to control commercialized private medical colleges, especially mandating that their fees must not be higher than government medical colleges. Further, expansion of medical education must be focused on public colleges rather than commercialized private institutions. The National Medical Commission needs independent, multi stakeholder review and reform, keeping in view criticisms that this body lacks representation of diverse stakeholders, has excessively centralized decision making, and tends towards further commercialization of medical education. The National Eligibility Cum Entrance Test NEET needs restructuring since this tends to place candidates from less privileged backgrounds at a disadvantage while encroaching on the autonomy of states in determining their own medical admission processes. These vital measures for reforming private healthcare in public interest should be part of wider processes for developing a public centered system of universal health care based on major expansion and strengthening of public services while engaging regulated private providers as per requirements. Drawing upon successful models such as the healthcare system in Thailand, such a system in India could provide rights based accesses to free and quality healthcare to everyone. Drawing upon successful models such as the healthcare system in Thailand, such a system in India could provide rights based access to free and quality healthcare to everyone. Today, all political parties should commit themselves to implementing these transformations, while as citizens we must strongly demand them. This would be a fitting manner to celebrate World Health Day in India in 2024.